Assalamualaikum and a very good day I greet to all my fellow friends and Dr. Cham Kim Gyo. Today, my group G, will discuss on the case study of bacterial meningitis. Our group members are Aryan, Dinarafika, Fajelin, Marjorie, Shamel, Noraina, Nur Shamila, and Fadlina. For the outline of our presentation, it includes introduction, case presentation, pathophysiology, nursing assessment, medical management, pharmacological management, nursing care plan, health education, conclusion, and also references. For the introduction, the objective of this case study is to prepare the nursing students into nursing workforce by consolidating the knowledge and skills acquired from the basic and specialized nursing science courses in the nursing program. The nursing students are expected to be able to plan for the nursing management of patient experiencing various health and illness related conditions, provide holistic, competent and safe nursing care, and apply critical thinking in the care of patient. So moving on to the case presentation, our patient Mr. F is a 23 years old Malay and Muslim male patient. He lived in Matang, Kuching, Sarawak by himself, and he has odd jobs, which is a driving instructor during the daytime and selling burgers during the nighttime. So the marital status of this patient is single. The date of admission to Sarawak General Hospital was on 7 February 2020, but he was transferred to Bau Hospital on 10 February 2020. The chief complaint before coming to emergency of SGH was he had headache for 2 days, which are throbbing and involved the whole head, face numbness for 1 day, fever and drowsiness for 2 days, and he claimed that he was physically stressed out and he has lack of sleep. So the diagnosis for this patient during our interview session was he was treated as bacterial meningitis. He also was diagnosed with acute kidney injury (AKI), which involved acyclovir induced, and he was newly diagnosed with hypertension. So before hospitalization, Mr. F felt drowsy and had fever for 2 days. However, he still went to work. The night before, he slept around 4:30 a.m. after finished selling his burgers. In the morning, he woke up early and forced himself to go to work even though he felt a throbbing pain on his head and his face started to numb. His face was pale and his friend advised him to go to the hospital. On his way to the hospital, he fainted at Pasar Satok. His friend called ambulance to bring him to the hospital due to his big size body. He was partially unconscious for 2 days because he claimed that he could hear people talking but could not open his eyes. When he opened his eyes, he had blurry vision. During hospitalization at Sarawak General Hospital, lumbar puncture was attempted twice but failed on 8 February 2020. And on 7 of February 2020, doctors order for IV acyclovir 750 mg TDS. However, they stopped it on day 3 on 9 of February 2020 because there are view of acute kidney injury. And the doctor reconciled on repeat lumbar puncture to establish diagnosis. However, the patient refused. So the patient keen to complete IV cetirizine 2 gram BD for 2 weeks in Bau Hospital. The patient was treated as bacterial meningitis and transferred to Bau Hospital on 10 of February 2020. For the medical history, this patient has a BMI of 43 kg per meter square, which the height is 180 cm and the weight is 140 kg. He is currently at the class 3 obesity. Previously, he has inner thigh abscess on 2011 and he was admitted for 1 week. Head injury due to road traffic accident in 2015 and admitted for 1 week. Poison intoxication in 2017 and he was admitted for 1 week. No food allergy, no drug allergy. The current medication during at the hospital Bau was IV ceftriaxone 2 gram BD, tablet amlodipine 5 mg OD, and tablet paracetamol 1 gram PRN. So the surgical history, he does not have any surgical history. For the family history, Mr. F is single. He is the youngest among 5 siblings. He has 3 sisters and a brother. His father died due to cancer. However, we don't know what type of cancer that his father claimed, because he also don't know what type of the cancer that his father claimed. So his brother has brain tumor and it resolved in 2017. His mother and all of the sisters has no non-medical illnesses. So as you can see, this is the family genogram. The father was born in 1954 and died in 2012 due to cancer. The mother is 60 years old. The sisters are 38, 35 and 32 years old respectively, and the brother is 30 years old. The patient himself is 23 years old. So for the social history, he can smoke up to 1 pack a day, and if he is stressed out, he could smoke more than 1 pack. He is a non-alcoholic person. He does not use any recreational drugs. He used to take protein supplements for workout in gym, but after that, when he stopped going to the gym, he also stopped taking the protein supplements, but he started to gain weight. He claimed that he ate 3 times a day. However, from our observation in the ward, he would buy food in the canteen and ate the food in the ward. So he also ate the food given by the hospital. So every meal he would eat for about 2 portions for breakfast, lunch and dinner for every meal.
Functional. Moving on to the pathophysiology of the meningitis. So the word meningitis comes from 2 words, which are the meninges and also the itis. The meninges are the membrane that surround the brain. The itis means inflammation. Therefore, the word meningitis means inflammation of the meninges that causes the meninges to swell and typically comes out with symptoms such as headache, fever, and also a stiff neck. But the question is, how does the swelling and inflammation happens? Before that, we need to know that our meninges consist of the 3 layers, which are the subarynoid space, the arynoid matter, and also the pia matter. The inflammation happens inside the subarynoid space, which consists of the cerebrospinal fluid, also known as the CSF, that passes through the foramina into the space from the 4th ventricle. The CSF functions as the shock absorber for the central nervous system when the brain and the skull are facing traumas. However, due to the infection and presence of pathogen in the bloodstream that is carried into the brain, that is how meningitis happens. Because of the barrier known as the blood-brain barrier that is not functioning well, resulting in a mix of CSF and also bacteremia or viremia. Meningitis can occur due to the viral infection, bacterial infection, also fungal infection. However, in our case, our client is diagnosed with the possibility of contracting bacterial meningitis, and as you can see on the slide, the bacterial meningitis can happen because of the various kind of bacteria such as the Streptococcus pneumonia. When the pathogens are present inside the bloodstream and there is leakage of CSF that disturb the brain barrier from the infection free, the pathogens will undergo autolysis if they eat from the autolysin, such as the autolysin encoding gene. The process will release subscapular bacterial components such as the peptidoglycan and bacterial DNA that are toxin to the meninges that will induce inflammatory host response. This will result in immune stimulatory effects on the dendritic cells and also on monocytes and macrophages. In other words, it means that there will be infiltration of leukocytes into the subarynoid space with increase of expression of pro-inflammatory cytokines and chemokines. Bear in mind that cytokines and chemokines are not good for the meninges. As a result, it will cause damage to the meninges. This can be tested when CSF fluid is collected and that shows elevated level of cytokines, when it means that there is presence of infection that require immediate attention from healthcare workers.
Pathophysiology of hypertension. Hypertension or high blood pressure is a medical condition where the pressure inside the blood vessel is constantly elevated. The risk factor of hypertension can be divided into two: modifiable factors such as diet, smoking status, alcohol consumption, the amount of physical activity, and stress. And also, non-modifiable factors such as gender, genetics, and age. The above risk stimulates changes that occur in the actions of sympathetic nervous system, which cause the smooth muscle to contract. The impaired renal functions and inappropriate activations of hormone regulating salt and water excretions by the kidney. The vasoconstrictions that occur will increase the vascular peripheral resistance. When the vascular resistance is high, the blood cannot circulate properly along the blood vessel. The poor blood flow will cause rise in the intravascular pressure, which is the force pushing against the blood vessel wall. Therefore, when blood pressure is taken, the reading will be higher than normal range. Pathophysiology of acute kidney injury. Acute kidney injury can occur due to various factors. Specifically for this patient, the acute kidney injury, which is likely induced by acyclovir, was aggravated by his previous excessive intake of the protein supplement. So, how can excess amount of protein in the body can cause kidney injury? The nutrients in the human body have specific amount needed for optimum body function. When the nutrient exceeds the requirement of the body, the substance will be excreted out. The organ responsible to filter out this excess substance, which is in this case is protein, is the kidney. So when there is high amount of protein in the blood, the intraglomerular pressure will increase, thus lead to the rise in the glomerular filtration rate. When the kidney keep on filtrating the excess protein for some period of time, the renal workload will increase, which will cause stress and damage to the renal cell. Thus, kidney injury will occur.
Nursing assessment. There are 4 assessments were done and conducted on 12 and 13 of February. The assessments are physical examination, important health function, Kernig sign, and Brzezinski sign. First assessment is using IPPA technique. Mr. F generally alert, oriented, cooperative, and able to work around work independently. He is well-groomed and tidy. Overall result of the assessment are normal. Since he diagnosed with meningitis, next assessment is highlighted as he able to do full ROM and no complaint of neck stiffness. Number 2 will highlighted on health perception and health management. Mr. F is a smoker. He smoked 1 pack of cigarette per day. However, he would smoke more than 1 pack per day if he was stressed. He seek for medical treatment whenever he was feel unwell. Next, nutrition and metabolic pattern. He has good appetite and current weight is 160 kg and no complaint of weight loss since hospitalization. Next is sleep pattern, sleep and rest pattern. He sleep around 4 to 5 hours per day. He claimed, and from observation, he rarely having afternoon or evening naps. He stated that he feel unwell and rested after sleep. The next assessment results are negative. These 2 tests to assess a patient suspected with meningitis or other spinocerebellar lesion that affecting spinal cord.
Next, we proceed to medical management. Doctor can diagnose meningitis based on certain diagnostic tests. And for this patient, he had undergone the following diagnostic tests, which are CT scan, lumbar puncture, blood urea serum electrolyte or creatinine, full blood count, and liver function test. So for a CT scan, basically the CT scan is an imaging test that creates 2-dimensional cross-sectional image. And CT scan of the head may show swelling or inflammation if the patient has meningitis. And this CT scan also can highlight the brain tissues to determine whether the meninges are inflamed or not. And this CT brain for Mr. F was done on 7 February 2020 during his admission at Sarawak General Hospital. The findings were normal with no acute intracranial bleed or focal parenchymalation. Next is lumbar puncture. As we all know, meningitis is an inflammation of the meninges, the covering around the brain and spinal cord. Most often, the inflammation is caused by an infection of the cerebral spinal fluid that also surrounds the brain and spinal cord. If meningitis is suspected, the definitive diagnosis is made by lumbar puncture or spinal tap. And in people with meningitis, the CSF often shows a low sugar or glucose level, along with an increased white blood cell count and increased protein. For Mr. F, lumbar puncture was attempted twice on 8 February 2020, but both attempts unsuccessful. The consent to repeat RP was done to establish diagnosis, yet the patient refused and keen to complete total antibiotic time 2 weeks at Bau Hospital. And in Bau Hospital, the doctor planned RP for Mr. F on 11 February 2020, but again he refused, so the RP could not be done for this patient. Buse and creatinine tests also have been done. This test will be focusing on the sodium, potassium, chloride, creatinine, and urea level in the blood. From the result on 11 and 19 February 2020, the level of potassium, chloride, and urea in her blood is in the normal range. However, the level of sodium is a bit lower than the normal range. Lower sodium or hyponatremia can be related to Mr. F since he is being diagnosed with acute kidney injury. Disorders such as kidney disease, cirrhosis, and heart failure can cause the body to retain sodium and fluid. Often the body retains more fluid than sodium, which means the sodium is diluted. Meanwhile, the creatinine level for Mr. F is elevated, which signifies impaired kidney function or kidney disease. As the kidneys become impaired for any reason, the creatinine level in the blood will rise due to poor clearance of creatinine by the kidneys. Next diagnostic test is full blood count test. This test is used to check for heightened level of certain cells that can suggest a meningitis infection. Tests of ABC were done for Mr. F on 11 and 19 February 2020. The result of the test were normal, but as you can see in the table, the procalcitonin or PCT level is a bit high on 19 February 2020. The level of PCT in the blood can increase significantly in systemic bacterial infection and sepsis. A high level could be a sign of serious bacterial infection. And lastly, liver function test or LFT. This test is used to check status of patient's liver. For Mr. F, these tests were done on 11 and 19 February 2020. Both of the results show high level of ALT, while AST level was high only on 11 February 2020. This elevated level of AST and ALT may signify the level of liver damage in the person. And the globulin level also show high level for the result on 11 February 2020. This high globulin level may indicate infection, inflammatory disease, or immune disease. And to summarize, all the results can be related to Mr. F as he is being treated as bacterial meningitis and acute kidney injury. The high level of PCT and globulin may suggest that he is being infected. However, the CSF analysis to establish the diagnosis of bacterial meningitis could not be done as the patient refused.
Moving on to the pharmacological management for our patients were prescribed with 4 medications, which is the IV aciclovir 750 mg, TDS, IV ceftriaxone 2 gram BD, tablet amlodipine 5 mg OD, and tablet paracetamol 1 gram PRN. The first medications, the IV aciclovir, was given from the 7th February until 9th February in 2020, and it was stopped in a view of AKI, and the patient's disease is unlikely to be viral meningitis. This medication drug class was antivirals, and its common names was Citavir or Zoviras. Its generic name was aciclovir. The indications of these medications is to treat infections caused by certain types of viruses such as herpes simplex, herpes zoster, and etc. The side effect of this drug is nausea, diarrhea, headache, vomiting, and many others. Mechanism of actions. Acyclovir is a synthetic purine nucleoside analog with in vitro and in vivo inhibitory activity against the viruses. The antiviral activities was in three ways. The first one is the competitive inhibitions of viral DNA polymerase. Second is the incorporation into and terminations of the growing viral DNA chain. And the last one is the inactivations of the viral DNA polymerase. The nursing responsibility for these medications is to make sure that the patients have no allergy towards the medicine, which is we have to assess the patient's history of allergic towards these medications. We also have to monitor patients' vital signs to detect early signs and symptoms of reactions to the medicine or any signs of overdose, because overdose and prolonged use may increase the risk of AKI due to nephrotoxicity, which can affect the kidney functions. We also have to advise the patients to continuously taking the medications and take it exactly as directed and finish the prescriptions even when they feel better, because skipping doses and not completing the full course of the medications reduce the effectiveness of the medications. The last one is to monitor the infusion site for the signs and symptoms of diabetes. The second medications, the IV ceftriaxone, will start on 10 February in 2020. The drug class is the cephalosporin third generations. The common name for this drug is rosepin, and its generic name was ceftriaxone. The indications is to treat and prevent infections that are proven and strongly suspected to be caused by susceptible bacteria. The side effect of this drug is like diarrhea or loose stool, nausea, dyspepsia, local reactions, and many other. Mechanism of actions. Ceftriaxone is a bactericidal agent that acts by inhibitions of the bacteria cell wall synthesis. Ceftriaxone has activity in the presence of some beta-lactamases, both penicillinase and cephalosporinases of gram-negative and gram-positive bacteria. The nursing responsibility for this drug is that we have to make sure that the patients have no allergy towards this medication, which is we have to assess the patient's history of allergic towards these medications. We also have to monitor the patient's vital signs to detect any signs and symptoms of reactions to these medications. We also have to inform the patients that the use of local anesthetic may cause methemoglobinemia. This is a serious condition that must be treated promptly. We also have to advise patients to continuously taking the medications and take it exactly as directed by the doctor and completing the full course of the therapy, because without completing the full course of the therapy, it may decrease the effectiveness of these medications and increase the risk of bacterial resistant development. Last one is we also have to monitor patients' conditions over time to identify early signs of superinfections, which can occur during therapy, as prolonged use of the medication may result in overgrowth of non-susceptible organisms. The next medications, the tablet amlodipine 5 mg, will start on 17th of February in 2020. The drug class was calcium channel blocker. The common name for these medications is Norvax and Ketorsia. The generic name is amlodipine.
The indications of this drug is to treat high blood pressure, coronary artery disease, and prevent chest pain such as angina. The side effect of this drug was like dizziness, nausea, shortness of breath, and many other. Mechanism of actions. Amlodipine facilitates the relaxations of the tissues and arteries to allow the blood to flow more easily to the heart by blocking the calcium from entering certain tissues and arteries. These conditions can help to lower the blood pressure and minimize the risk of heart attack. Nursing responsibility for this drug is that we have to make sure that the patients have no allergies towards these medications, which is we have to assess the patient's history of allergic towards these medications. We also have to monitor patients' vital signs to detect early signs and symptoms of reactions to this medicine. We also have to encourage the patients to take the medication with meals to prevent stomach upset and encourage them to report if they presented with any abnormal signs and symptoms such as irregular heartbeats, shortness of breath, dizziness, and constipations. The next medication is the tablet paracetamol, which is start on the 10 February in 2020. The drug class is the analgesic antipyretics. The common name for this drug is the Panadol, Excedrin, Calpol, and Tylenol. The generic name is acetaminophen. The indications of this drug is to treat mild to moderate ache, pain, and relieve fever. The side effects of this drug is such as skin rashes, severe dizziness, blood disorder, and many others. Mechanism of actions. Paracetamol is a non-opioid analgesic. Acetaminophen is thought to act primarily in the CNS by increasing the pain threshold by inhibiting both isoform and cyclooxygenase. The COX-1, COX-2, and COX-3 enzymes involved in the prostaglandin synthesis, which can effectively reduce pain and fever. The nursing responsibility for these medications is that we have to make sure that the patients have no allergy towards this medicine, monitor the patient's vital signs to detect early signs and symptoms of reaction towards these medications, and we also have to advise patients not to take any other products containing paracetamol, which is we have to tell them to read the label of all other medications that they take from other counter or outside of the hospital to prevent the risk of overdose. We also have to advise patients to avoid alcohol because taking alcohol with paracetamol can increase the chance of getting the side effects.
In Kaplan, we have planned 5 nursing diagnoses, which is we prioritize based on the important first. So the first one is decreased cardiac output related to impaired contractility of the heart, as evidenced by patients' blood pressure, systolic, which is ranging from 139 to 159, and diastolic ranging from 97 to 109. Second one is imbalanced nutrition, more than body requirement, related to his uncontrolled diet and unhealthy lifestyle, as evidenced by patient's body weight is 140 kg and his BMI is 43 kg per meter square. And the third one is risk for fluid volume deficit related to acute kidney injury. And the fourth one is risk for ineffective cerebral tissue perfusion related to increased intracranial pressure. And the fifth one is risk profile related to body size and symptoms of meningitis. So why we put decreased cardiac output first? We put this because we believe that we prioritize based on A, B, C, D, E. So decreased cardiac output related to heart and perfusion. So we believe it is the most important one, and involve essential body system. And second one is imbalanced nutrition more than body requirement. So by the time we assess this patient, he is really he cannot control his diet even though he is in the hospital. In the hospital for the past few weeks, and he seems to not aware about that. So the third one, we put risk for fluid volume deficit because during our assessment with him, his acute kidney injury is already resolved, and he is also does not have any supplemental fluid or intravenous fluid prescribed. And so we put it as risk for fluid volume deficit because due to the previous problem to the kidney, it may make him at high risk for fluid volume deficit. So the fourth one is risk for ineffective cerebral tissue perfusion because when someone have meningitis, the infection can cause increased intracranial pressure. So increased ICP can lead to ineffective cerebral tissue perfusion. And the fifth one is risk of related to its body size. Why we say his body size? Because he is very big and he's tall, so he is at high risk for fall and symptoms of meningitis because meningitis can also show symptoms of headache. So this may put him at high risk for fall. So from the 5 nursing diagnoses, we have prepared 2 full nursing care plans for this patient. So the first one is decreased cardiac output related to impaired contractility as evidenced by blood pressure of systolic ranging from 139 to 159 and diastolic of 97 to 109, which these readings was taken during our assessment, which is 17th of February 2020. So our goal for this patient is that patient will be able to have normal PP, which is systolic ranging from 100 to 120 and diastolic of 60 to 80 millimeter mercury within 2 days of intervention. So what we do for this patient is that first we assess his vital signs, especially his blood pressure. So this is to provide our baseline data, and then monitor vital signs for significant changes because we would like to determine the changes before and after the interventions, and this is to detect if there's any effectiveness for the intervention. So we also administer medication as prescribed, which is this patient is prescribed tablet amlodipine 5 mg once daily. And then the fifth one is we explain to patient and family members about the possible side effects of this medication because our patient is he said this is the first time he was prescribed with this with antihypertensive. So he may not know the side effects of how the medication could affect his body differently from before. So we also monitor any side effects if any because it is to ensure that patient body can compromise, and maybe if there's any side effect, we can report to physician so that he can change his medication or something. So we evaluate that patient blood pressure was recorded decreases gradually within the 2 days with systolic range from 170 to 126 and diastolic range from 76 to 83 millimeter mercury on 19th of February 2002, which is after 2 days of our interventions. So even though the systolic range is not really between the normal range, it is showing that the interventions and the medications is work well on these patients. For the second one, nursing care plan is imbalanced nutrition more than body requirement related to uncontrolled diet and unhealthy lifestyle as evidenced by patients' body weight of 140 kg with BMI of 43 kg per meter square. This is on 18th of February 2020. So, forget to mention before, why we put his body weight and BMI in at one of the prioritized nursing care. It is because of his body, because of this obesity, it can cause him to get many other diseases. So even though he is have meningitis, so as we can see, he is gradually developing hypertension. So move on to the goals. So our goal for this patient is that patient will verbalize the importance of healthy lifestyles and able to participate in health promotion and ready to change lifestyle and his diet. So what we do for this patient is that first we assess patient's body weight and BMI. This is to provide medicine data and for further interventions. So and then we request special diet for patient during his hospitalization. This is to ensure that patient will have sufficient nutrition and amount of food in order for the patient to lose weight. So this patient was ordered normal diet with low salt since he has hypertension. So motions intake and output. This is to make sure that the intake and output are balanced and to identify the food and drinks that he consumed by preventing from imbalanced nutrition board and protein requirement. And then provide health education regarding healthy lifestyle and balanced diet. Is to provide better knowledge since he knows that he is obesity, but he doesn't know how to control, and maybe we can advise on some improvisation or initiative for him. And then we monitor vital signs, especially blood pressure, heart rate, and oxygen saturation, because these vital signs can show any changes or signs of abnormal in cardiovascular, which affect the cardiovascular system, and to identify any signs of cardiovascular disease, because obesity is can lead to many of the disease. And then we encourage patients to change lifestyle and diet, because lifestyle and diet play very big role in maintaining good health and to promote weight loss. So after a few days of the intervention, we evaluate the patient able to verbalize the importance of healthy lifestyle and able to participate in health promotion and ready to choose.
Move on to health education. So firstly, since our patient have a bacterial meningitis, so we advise the patient, in order to reduce the risk of patient having another bacterial meningitis in future, we must educate him when coughing, sneezing, to prevent and spreading germs. Next, then perform hand hygiene effectively to prevent getting transmitted with the germs. Next, we don't share drinking glasses, eating utensils or other items with anyone who's sick or if he feels sick. Another one is protect himself from mosquito, other insects and rodents that can be spread through some virus that cause meningitis by applying mosquitoes or insect repellent if going for outdoor activities. And last one is follow-up vaccination of pneumococcal vaccines that have been scheduled by the doctor of himself. So, moving forward, the health education for hypertension and obesity, since this patient is like newly diagnosed with hypertension and having obesity. So we advise them to continue taking antihypertensive medication and do not stop taking it without doctor consultation. So we encourage him to have healthy lifestyle also, with exercise frequently, exercise gradually, or less invasive to more invasive exercise to protect his joints due to obesity. Then the next one is quit smoking and avoid taking alcohol or any drugs. So we educate the patient to stop smoking as he smoked before, like 1 pack per day. And we educate the patient to pretty healthy diets also. We're introducing the DASH diets. We stand for dietary approach to stop hypertension, for controlling high blood pressure and reducing weight. So and then low calorie diet. low-fat diets for obesity. So we'll introduce you what the DASH diet is. DASH diet is a healthy approach that has been scientifically proven to lower blood pressure and have other health benefits. The DASH eating plans require no special fruits and instead provide a daily and weekly nutritional goals. This plan recommends eating vegetables, fruits, and whole grain, including fat-free or low-fat dairy products, fish, poultry, beans, nuts, and vegetable oils. Limiting foods that high in saturated fat, such as fatty meats, full-fat dairy products, and tropical oils such as coconut, palm kernel, and palm oils. Lastly, limiting sugar, sweetened beverage, and sweet. All of these automatically can help them in obesity, which may have a healthy diet for him also. So moving on for health education acute kidney injury, where this patient have underlying acute kidney injury. So we advise them drink less fluid if instructed by your healthcare provider, and keep a record of everything you eat and drink so you can monitor what you drink and eat. Then this can help your kidney works better and decrease your risk for dehydration. Next is eat food that are low in sodium, which is salt, then low in potassium, phosphorus, or protein. And lastly, educate the patient to follow the follow-up appointments with the doctor, like how to control his acute kidney injury.
So for the conclusion, in conclusion, we were able to apply our knowledge and skills acquired from the class, clinical skills lab, and various experiences from different healthcare facilities that we have attached since the first year in the nursing program. In the case study, we are able to manage the patients with bacterial meningitis by giving competent and safe nursing care, providing care holistically, and apply critical thinking in the care of patient. We were also managed to perform interview and acquire the necessary assessment of the patient under our care. With the cooperation from the patient, we were able to evaluate and report the case of patients efficiently throughout the practicum in Bau Hospital. So that's all from us. Thank you.